We estimate that this will impact about 118,000 workers in licensed early learning and child care programs. Now talking about our higher education system. Our higher ed vaccination requirement is consistent with these other measures as well. Staff, faculty, contractors, coaches, volunteers, and visitors are required to be fully vaccinated by October 18th. And by the way, I do want to reiterate, in order to be fully vaccinated by October 18th, you will have to begin your vaccinations before that. We know that the Moderna and Pfizer vaccine require 2 doses. The very latest for the last dose of either of those or the first dose of the Johnson would have to be by October 4th. I just want to reiterate that. So people have to start their vaccination well before October 18th to comply with this requirement. The requirement in higher ed does not cover students. We estimate this higher ed requirement impacts about 90,000 staff, faculty, graduate students, and other employees. I want to take just a minute talking about some of the rationale for this. And this starts with the rationale that these vaccines are incredibly effective, amazingly effective. They are a medical miracle. And they are a double miracle because not only do they save lives by the tens of thousands, and Dr. Shaw will talk about that, but they have minimal side effects. 169 million Americans already know this is true, that these vaccines save lives and have minimal side effects. More than 95% of the COVID hospitalizations we see today are among the unvaccinated. The unvaccinated people are those at risk in Washington. And those are the people we love and we care for. And it is heartrending for us to see losing our neighbors, our co-workers, our students to a preventable disease. And it's 95% of our people in hospitals today fall into that category of not having this life-saving vaccine. The more people get vaccinated, the closer we will to being able to stop transmission of the virus. I'm convinced that we are at the point in this pandemic that without these vaccine requirements, we will continue to be susceptible to new variants. So this is the right thing to do to save lives in the state of Washington. And we're going to do our level best to share accurate medical information with Washingtonians. And the more people who have accurate medical information and don't fall prey to the misinformation on the internet, the more lives are going to be saved. And whatever you do in response to this proclamation, please talk to your medical providers about this vaccine. Please ask the people who really know, which may not be politicians. It may not be your brother. It may not be your coworker, but it is your physician. Ask them what they know about this vaccine if you have any questions about it. Now, there will be some exemptions. Someone with legitimate medical reasons that are shown and demonstrated, or sincerely held religious reasons for not getting the vaccine, will be able to seek an exemption. These exemptions do not include personal or philosophical objections. Again, this is to keep employees and the people they work for safe and to increase protections for the communities they serve. Because we are well past the point where testing is enough to keep people safe. We've tried it. It has not been adequate to the task at hand. If I can turn to the masking order for a minute. We have seen, and this is great news, over the last year how widespread masking can reduce the growth of this pandemic. We loosened masking requirements at a time when our vaccination rate was growing quite rapidly and when our case counts were dropping quite rapidly. But unfortunately now, both our case counts and our hospitalizations are exploding. It is not uniform. In fact, it's very non-uniform across the state of Washington. Some of our areas have in the 80% plus range. Some are in the low 30s. The fact that there's a 50% difference from community to community poses a danger to the whole state of Washington. But we need to have a statewide response to this because every single life counts in every corner of the state of Washington. Therefore, we are requiring all individuals, including the vaccinated, to mask up inside. This updated mask requirement will take effect Monday. It applies to public places, restaurants and offices, shops. It covers everyone in a public-facing setting, regardless of their vaccination status. So in a place that is open to the public, everyone needs to wear their mask in those conditions. It does not cover vaccinated workers who do not have face-to-face interactions with the public in those settings. Now, this is important, however. Unvaccinated workers will continue as they are today, will still be required to wear their mask in all conditions on the job. This is a job requirement, and it is a safety requirement, even in non-public facing operations. So if you're not vaccinated at this moment and you're on the job, you need to be wearing a mask, whether it's in a public or non-public part of your operation. It also does not apply to gatherings that aren't accessible to the public when everyone in attendance is vaccinated. The mask mandate will also not apply to athletes in indoor sports when they are actively engaged in game or practice. But when they're on the bench or sidelines, we need them to put their mask back on. Those younger than 5 or who have medical conditions that prevent mask wearing are not required to follow this mandate. This will take effect on August 23rd. For those who are frustrated by any of our actions against this pandemic, we need to be really clear, and it is very clear why this is happening. It's because not enough people are getting vaccinated. And the sooner we get more people vaccinated, the sooner we can free ourselves from interruptions, masks, and other interruptions in our lives. That's the nature of this problem. And we are addressing it today by taking action that is fundamentally necessary. We know that masks will help diminish the threat of chaos in our lives. It's going to help us turn the corner and suppress, to some degree, this virus. But we need to be clear. Ultimately, there's one way out of this problem, and it's through vaccination. And the sooner we realize that, the sooner we will get this in a manageable situation. Now, why are we in this position today? Why are we in this fight? In a sense, this is a new fight. In a sense, this is a new virus. The Delta variant presents a whole new challenge to the state of Washington. And just as we said since the start of the pandemic, we've got to tackle the tools, we've got to tackle new threats with the tools we have, and that's what we're doing today. This week, our state broke its previous record for COVID hospitalizations set in December. The rate is, as I said, spectacularly almost vertical on our charts. We're witnessing exponential growth. I've not used that term in some months, but regrettably, that is now the situation that we are in. And the reason is clear. This virus mutated. There's a new game in town, and we have to fight it with the tools we have at our disposal. Hospitals are swamped. Our workers in healthcare are exhausted. They've been doing heroic work for months and months now. Communities are stressed, and I have not seen a single trend that would suggest it's going to slow down in the absence of new action. That means we are in the middle of an explosive threat in our community, and we intend to confront it. And we know vaccines work, we know masks works, and together we know they both are going to help us forge a new path in our state. I also want to point out that this is a somewhat new situation as to who the victims are of COVID. When we started this endeavor, we thought of just those in nursing homes and those of certain age. But that's not the situation anymore. The burden of COVID surge is falling on all age groups, but this virus is increasingly impacting young people. This is because infections are primarily in people who are not vaccinated. And I will remind us that people under 12 still can't get this life-saving vaccine. So when you decide to get a vaccine, you're protecting a kid out there who can't get it. Pretty noble work, it seems to me. We want to send our kids back to school, and these are 2 steps we can take to make sure we can do this. And I'm looking forward to getting both of this are done. There are roughly 2 million people in Washington who are 12 and older, eligible for the vaccine, who have not yet received a single dose. So more of us have to do our